Okay, we still have a few folks signing on, but for the sake of time, we will go ahead and get started. Again, hello and welcome to this webinar on health centers as age-friendly health systems. My name is Ariel Mather, and I'm the program manager at the National Center for Equitable Care for Elders. We are so excited to have our featured presenters from the Institute for Healthcare Improvement, IHI, Leslie Pelton and Laura Howell join us today. Give me one moment, there we go. If you are new to NCECE, we were established in 2017 as a program of the Harvard School of Dental Medicine here in Boston, Massachusetts. We're supported by the Health Resources and Services Administration, or HRSA, of the U.S. Department of Health and Human Services. We have a National Training and Technical Assistance Cooperative Agreement, or an NCA. So we're here to provide support to health centers, PCAs, other groups to be able to provide quality and inclusive care for older adults. We'd love for you to stay connected with us both during and after this webinar. You can see the links on this slide. We'd love to hear from you. We'd love for you to participate in future sessions. We certainly acknowledge that this is a stressful and uncertain time. We're grateful for your attendance, and we are certainly going to make the recording of this session available to those who are not able to attend. Health centers certainly play a really vital role in providing care to community dwelling older adults, always, but especially at this time. And we have a dedicated resources page on our website with helpful information from reputable sources, including conversation guides in discussing COVID-19 with older adult patients and their families that we think are really helpful. If you're interested, we encourage you to check that out. Also wanted to link you to the Health Center Resource Clearinghouse page. This is a helpful set of resources from all of the national cooperative agreements that are funded through HRSA around a variety of topics, but we do have an emerging priorities page on COVID-19 that has a really wide array of helpful publications and resources for you to use at your health centers with your patients. So we encourage you to check that out as well. Just a few reminders before we get started with this presentation. Because we have a great group of folks on the line today, we do have all lines muted to prevent any echo and background noise. So if you are unmuting yourself to ask a question, it might be good to mute yourself for now, use the chat box, and perhaps at the end we can unmute some lines for further discussion. We have a lot of folks who are very knowledgeable about the age-friendly framework who will be able to do some answering to questions in the chat box, as well as our presenters during the session. Like I mentioned, this session is being recorded. We will make that available on our Dropbox very shortly. We'll send you an email after the session completes with a link to that Dropbox. We'll have the PDFs of the slides there as well. And certainly we'd love to hear your feedback. We will provide a quick evaluation link in the chat box at the end of this session. We will also email that out. That helps us to shape future training activities and to hear your thoughts and concerns. So please fill that out if you have the time. All right, so these learning objectives, you likely read them when you signed up for this session. We are hoping you'll be able to walk away from this webinar today, being able to describe the importance of aligning care with an older adult's preferences and their health outcome goals. We also hope that you'll know how to identify your particular health center's strengths in providing evidence-based care for older adults, and being able to identify some strategies for incorporating the 4Ms framework into a primary care setting. Like I mentioned, we are honored to have a few speakers today, both from the Institute for Healthcare Improvement. I'd love to read their bios for you now. Leslie Pelton is the Senior Director at the Institute for Healthcare Improvement and has more than 20 years of experience managing, leading, and facilitating successful organization transformation and performance improvement in the healthcare industry. She works in academic medical centers and hospital licensed community health centers to advise leaders on improvement strategies, especially as they relate to design and implementation of accessible and effective care. In addition to advising leaders and teams, Ms. Pelton conducts individual leadership development coaching with a specialization in supporting physicians as leaders. She brings to each of these individuals and organizations in-depth experience with strategic planning, leadership and team development, and organizational change. Joining Leslie is Laura Howell, who is a project manager at the Institute for Healthcare Improvement. At the IHI, Ms. Howell's work has focused in the health portfolio first with supporting and managing the operations and various technology projects for the 100 billion Healthier Lives movement. Then Ms. Howell focused on healthcare's role in improving the care for communities and its members before joining the Age-Friendly Health Systems team, where she supports action communities led by IHI and other partner organizations. Before coming to IHI, Ms. Howell worked for a hospital in rural Maine, where she worked across the life course to improve community health. I'd like to welcome Leslie and Laura now and take it away.
Thank you, Ariel. This is Leslie Pelton. It is really wonderful to be with all of you today. I want to say right up front that I am trusting that many of you are in a very challenging time in your communities with the older adults and the families that are in your care. And it really is an honor that you're taking the time here today to dedicate to thinking more deeply about the care of older adults during this time and always. So if you go to the next slide, Ariel. Because as Ariel said, this being age friendly is so much about starting with what matters to the older adult. We will just take a moment to do introductions, all of us, on that particular item. I want to give you some background, make sure that you're clear about what the age friendly health system movement is. And I especially want to think with you through the chat about what this means in a community health center. For whom I just have so much respect, and I see so much alignment and opportunity here. And throughout, although I put it, as the third bullet here, throughout, I encourage you and invite you to ask questions, to chat in comments, and we are going to be watching for those. And I have invited Ariel and Laura to please interrupt me at any time for your questions and comments. I also want to acknowledge that in addition to Laura Howell, who you will meet in a moment and hear from, we have on the line today Kellyanne Pepin from IHI, and we have Alice Bonner. Alice is our Senior Advisor on Aging. She's with us today, and in case your paths have not crossed in the many roles that Alice has had in the care of older adults, I want to give you a chance to say hello. I think you're off of mute.
I think I am off of mute. Thank you, Leslie, and I'm delighted to be with this group today. It's very exciting to see age-friendly work taking off around the country across all settings, and we're really grateful for everything that you're doing at the point of care, especially in these times. So thanks so much, and I look forward to the conversation.
Thank you, Alice. That's wonderful. Ariel, if you please go to the next slide. So I'm going to invite everybody to chat in the lower right-hand corner. If you would make sure that you select everyone, and then type in your name, your health center or association or organization you're with, I think we're all here from the U.S., so where you are in the United States, and just a couple of words about what matters to you about being age-friendly in this time of COVID-19. Because while we can have this commitment to older adults over time, sometimes what matters and this work can mean something different to us as times change, as they are right now. It looked like when I looked at the list of people that were be joining us, it looked like there was a great representation from across our country. So encourage folks to chat in. Wonderful. We have Washington, D.C., Rhode Island with us. We have people from associations, people in the health centers. This is great. Oh, great. Oklahoma State Department of Health, wonderful. Falls prevention, healthy aging. Oh, we're going to love talking about the forums with you. Family Healthcare Network, great. Oh, this is terrific. And we have Becky on from Bay State. Becky, it is so nice to see you here. Been very much in my thoughts. Great. Oh, health equity research, terrific, and promotion in Philadelphia from the VA. Oh, this is great. And Des Moines. And we do have the whole country crisscrossed here. I would encourage you to look through the chat yourselves, see who's on that maybe has a title, is part of an organization that you want to connect with, and feel free to use the chat to talk with each other and learn with each other. Thank you, Kelly and Pepin from IHI. Chatting in Age Friendly right now means making sure older adults know that they're cared about and not alone at this time. That can take extra effort on all of our part, and so incredibly important. Thank you. Thank you, Alice, for chatting in. The forums framework provides structure and methods during a somewhat chaotic time. Yes, when we have a lot of anxiety, sometimes a framework can be most helpful to reduce our anxiety and fear. Thanks, Alice, for making that point. Yeah, and we're all very much aware of vulnerability of older adults at this time. So keep on chatting. If you go to the next slide, I just want to tell you a little bit about why this work matters, why this work matters to me. I actually started my career many years ago in Philadelphia, working with the city of Philadelphia on with their community health centers. It was the very first job that I had in the health and healthcare space, and boy, did that just launched me. It launched me into what I do all these years later today. And I was so pleased when I was putting this together to have the opportunity to revisit with some connections in Philadelphia and see how much the community health center role in the community has grown. So I wanted you to know that my roots are in community health centers, and you'll see in the right-hand corner of this slide, my mother and my son and I holding a Mike's pastry from Boston, from You Can Tell, a different time when we could be out and about doing these things. And my mom is lives not too far away from me. She's very clear with me that I do not care for her, I care with her, and she keeps me grounded. And I have to say, knowing what matters for her and to her has really kept me grounded during this COVID-19 time. And helping and allowing her to make the choices that matter to her, allow her to move in a way that works for her. So the 4 M's have been a guide for me during COVID-19 with my own family. I want to invite Laura Howell, a treasured colleague from IHI, to introduce herself. Laura, and if you go to the next slide, Ariel, please.
Thanks, Leslie. Thanks, Ariel. So I'm so honored to be able to share why this work matters to me as well. On this slide, you can see one of my favorite pictures of my maternal grandparents, Richard and Joanne. This picture was taken at my first family home sometime in the early 2000s, and later on in both of their lives, my grandparents became ill with 2 different forms of cancer. And I watched so very much of a difference in experience in their care that they received, including, but not limited to, the very differences in experience in hospice care. And although I'm not an older adult myself, I saw firsthand the huge impact that care has, and the types of care received has, on both the patients and families. And I don't want any older adult or anyone for that matter to experience the type of care, the negative care, I must say, that my grandmother experienced. And that's why this work matters and is so personal to each one of us in this work. And thank you for letting me share my story.
Laura, thank you for sharing your story. Yeah, if you go to the next slide, Ariel. I also want to ground you in our organization, the Institute for Healthcare Improvement. I like to say we're a small and mighty organization, and what matters to us as an organization is to improve the health and healthcare of people worldwide. And on the next slide, you can see that we are based in Boston. We work in 42 countries. Here's a picture of our office in Ethiopia. And our vision is that everybody has the best care and the best health possible. And on the next slide, you can see how we go about that work. We pursue safety, high quality care. We are completely vested in building the capacity and capability in organizations to improve, that we work focus in populations, and we are here to spark innovation and share bright spots even in this very, very difficult time. You'll know that age-friendly and recognize that age-friendly health systems fits right in this work. We are driven by improvement science. That's a part of our work with age-friendly care. We're driven by health equity. We want to ensure that all older adults' care and health is improved through the movement. And we're driven by joy in work because we know that our work and our work, professional and personal time and hours are more joyful when we know they're grounded in what matters to the people that we are caring with. Again, coming back to the 4 M's. So that's the Institute for Healthcare Improvement. On the next slide, I want to welcome all of you to the Age-Friendly Health Systems movement. We are committed to making sure that the care of all older adults is age-friendly, and by that we mean that it is grounded in the evidence of what older adults benefit from, that it certainly causes no harm, and that it's consistent with what we hear and what we create the space to ask older adults what matters and hear from older adults and their families. By the middle of 2023, we are looking forward to being able to reach 2,500 hospitals, practices, and post-acute communities. So if you go to the next slide. We really recognize that, and I think have been really grounded and affirmed, but surprised how much age-friendly health systems has resonated even in this time of COVID-19. And all it takes is to look at a graph like this of the severity of COVID-19 by age group in the US to really be reminded of why it matters so very, very much right now. And on the next slide, again, want to acknowledge that health equity and reducing disparities is a part of our work and a part of our design right from the get-go. In our improvement work, we are always encouraging and looking for health systems to work with who will stratify data by race and ethnicity, again, so we can make sure that all the health of all older adults is improving, and that we are doing nothing to exacerbate disparities, and in fact that we are closing those gaps. And again, it just in COVID-19, the importance of that just seems underscored everywhere that we turn. And on the next slide. This work, even before COVID-19, had such importance, and I suspect that many of you are experiencing this in your communities, which is that we're aging as a nation, that older adults as a percentage of our population are increasing, and that means that if we don't reduce harms that are caused to older adults, if we don't ground ourselves in the evidence-based care, then the number of older adults who are negatively impacted is going to grow. And in a positive light, we have the opportunity to impact more and more of our percentage of our patients as we do improve care with older adults. And on the next slide, this was such a profound graph for me. This was one of the health systems that we were working with. This is what they were experiencing projecting would be the growth, the change in their population over the next 20 years, and very compelling for them to consider how they need to right now attend to making sure that their organization, their health systems are aligned with the needs of older adults. And on the next slide, just a bit more about the why behind age-friendly health systems. When we did our own analysis of one of the ways that we identified the need to provide age-friendly care was because we looked at what was happening with older adults and realized that PACE and the ACE programs and all of the models that were focused on older adults were still only reaching a very small percentage. If you stretched it maybe to 10% of the older adult population, which meant that 90% of people were not, older adults were not being reached with evidence-based care. So on the next slide, what we decided to do about that is to look at those models. We looked at 17 different care models that had a level 1 or 2A evidence of impact, and we said, what is it that is, what's going on in these different models of care? And this was back in August of 2016, or the summer of 2016, and we looked at all of those models. We found 90 different care features. We were able to whittle that down to 13 discrete different care features. And then we, in August 16th of 2016, we convened a group of experts, and you can't see, but I'm putting air quotes around experts. We brought together people, expert meaning in many different ways, people who were leading health systems, people who were at the point of care, people who were older adults themselves, people who were payers and regulators. And we said, this is great that we have 13 different aspects of care that are a part of evidence-based models, but there is not a health center, there isn't a practice, there isn't a hospital in this country that's going to adopt 13 different ways of delivering care. We've got to get this down to what we called the vital few. And this group of experts arrived at the 4 M's with us, and on the next slide, you can see the 4 M's. This is the framework behind what it means to be in an age-friendly health system. Always beginning with what matters. I just want to point out around what matters that while it includes end of life, it is not at all exclusive to end of life. And it is also medication if they're needed. Make sure it doesn't interfere with what matters. Mentation, or the health of the mind, in the community setting, focused on dementia and depression, and mobility, making sure that people can move every day in a way that matters to them. So really, it's very, very circular and very interconnected. If you go to the next slide, I want you to see the evidence base behind the 4 M's, and you'll have these slides, so you're very welcome to go through this. So if you go to the next slide. I want to acknowledge that we are adjusting, we are making sure that as we're talking about the 4 M's now, we're talking about them in the context of COVID-19. You find a blog on ihi.org, we can send you the link, where we really break out what it means to use the 4 M's in a telehealth visit. We actually went through, developed with a colleague colleagues from the VA, I know we have some folks on from the VA today, what is a script for a telehealth visit? How do you ask what matters over the phone? How do you do a medication check? Can you do the mini cog? Things like that. So we're really focusing and providing a lot of resources around what it means to be age-friendly in the time of COVID-19. And if you go to the next slide. So just to reiterate, the 4Ms framework, as Alice chatted in earlier, can be very useful in a time of crisis and what feels like chaos. Even what we have experienced with the teams that are part of this movement, we have 625 teams from representing every state in the U.S. that are a part of this movement. What part of the feedback we've heard is how useful the 4Ms are to reduce burden of what can be very complex visits with older adults, and that it gets right to the heart of what matters to older adults. I see a question in the chat that I want to comment on. The question is that one barrier we've seen with health centers is that they have troubles keeping elderly patients at their centers, and what have health centers done to improve keeping the elderly as patients? And there's some agreement that this is a challenge. There is a comment around the rising cost of care, and I want to share some of our experience in conversations with health centers and others, which is that it can be very affirming for the care teams and for the older adults to be clear that the care that they're receiving is evidence-based, that it is excellent care, and really, again, grounding the care in what matters and taking the time for that conversation can be very reinforcing of the relationship that health centers often have with older adults. I want to, Alice, if you want to speak up and reflect on that, glad to have you share. Yeah.
Sure. Thank you, Leslie. You were reading my mind. I was thinking about this. So, as a nurse practitioner for 25, 30 years, in nursing homes and assisted living, I, was a clinician, as many of you on the telephone are. And what I would say is so much of this is really, if it's front loaded with the admission visits and those early conversations that nurses and social workers and other clinicians and nursing assistants, have with people coming into the nursing home, I think that really helps, because then you get to talk about what matters and you get to document the goals and the wishes and the preferences that the older person themselves have, and you get to document that in the record. And then when there is a change in condition, or if something happens rather rapidly, you've got that information and you know who the healthcare proxy or the power of attorney is, etc. I think, to Leslie's point, in a lot of nursing homes or skilled nursing and rehab organizations around the country, when someone gets sick or falls and has an injury and so forth, there is very often a response to send them out to the hospital or the emergency department for evaluation, which, of course, as we all know, sometimes that's the appropriate method. But there just hasn't been as much discussion over the last several decades about the kind of evidence-based care that Leslie's been talking about here, that we can provide in so many of these communities. So I think it's important, know what you can provide in your community, talk with your team, make sure it's an interdisciplinary team having a conversation, and then kind of be as ready as you can be to have the conversations. I see Kellyanne chatted in a blog about effective telemedicine. So we are looking at many different ways to have these, these communication strategies. So thanks, Leslie.
And Leslie, there's one other question that I wanted to lift up as well. There's a question about engagement. The question is, does IHI reach out to health systems to join the age-friendly movement, or do we wait for health systems to reach out, or how does it work?
Laura, do you want to answer? You're welcome to answer that question.
Yeah, I'd love to.
Comment.
And we'll speak a little bit about engagement later on in the presentation too. Anyone, any health system practice or post-acute long-term care community is welcome to join in different ways, whether it's through an action community or using the 4Ms framework on their own and at their pace of the team that they're working with, really through the ihi.org/age-friendly website is where you can access all of those resources and how to engage.
Thank you, Laura. And I just chatted in that website, and we really we want to keep the barriers to entry low because we know that there's so much need for improved care of older adults, and we especially want to work with you as community health centers because we know you're so engaged with your communities and with the families, including older adults care. And so feedback that you have as we're going through this conversation is really helpful about what some of the challenges and also what if any of you are part of the movement, have already been involved in IHI and other activities, we'd love to hear what's working for you as well. So I'll keep going. If you go to if we go on to the next slide, I want to get really specific, really concrete with you about what it means to be age friendly. I showed you the 4 M's and described those. And what you see here is on the right-hand side are the 11, I'm pretty sure it's 11, I've been saying that for a while now, 11 aspects or of care that make up being age-friendly when you take the 4 M's in a community-based setting. So in a health center, in a practice, the expectation is that the 4 M's will be known for each older adult in our care and that they will be acted on. And what that actually looks like is making sure that we ask at least once a year of an older adult, and many systems decide to do it at every visit, what matters, that's documented, that we know if somebody is on high-risk medications, that we work towards deprescribing those if possible, or not prescribing them in the first place. So those are some examples of operationalizing and putting into practice these elements of being an age-friendly health system. I want to say that over on the right-hand side of this that's blank is the place for you to work through exactly how you will do this. So for example, how you ask what matters, the actual words that you use, who asks what matters as part of your care team. Is it the very first person that the older adult meets with when they're walking perhaps from the waiting room back to the exam room? Or is it the very first person that they speak with in a telehealth visit? Is it an NP? Is it an MD? All of that is up to you. We wanted you to have the space to decide how you were going to practice this in your own health center. Now we have a guide to using the 4 M's. I see some chat about sharing materials. All of this will be shared with you on ihi.org/age-friendly. In the upper right-hand corner, there's a guide to using the 4 M's where there's lots of tips and experiences that others will share about how they practice this, but we wanted you to have lots of space to for this to fit your health center. So if you go to the next slide. We offer up what we consider to be an age-friendly health system measures or an age-friendly health system dashboard. I want to be clear that we know how burdened everybody is in this And so I wanted to highlight the 2 outcome measures that are specific to community-based practices. So it's the CG CAPS and ED utilization, and those are what we offer up. The innovation around an age-friendly health system, because this is likely not new data that you're collecting, although the ED may be for you, depends on your relationship with the local hospitals. But the offer of being age-friendly is to stratify these measures by age and by race and ethnicity. So again, making sure that as you put the 4Ms more reliably into practice, that everybody is rising, everybody's health and healthcare is improving. So those are the outcome measures on the left side. On the right side are the process measures. I want to be clear that at IHI, these are an offer. We're not going to require anybody who's part of this movement to share these measures. We love it when you do. We will work with you and bring resources to helping to do that. But we know that that may not be something that you're able to do, and we do honor that. I want to just turn to a question that came in the chat about PCMH. Just like PCMH offers incentives for health centers to become PCMHs, do you think the same happening with becoming an age-friendly health system? What a wonderful question. I would love that. I will say, and I maybe on one of these later slides, we have been in conversation with NCQA, who is also very interested in measures around what matters, and also very interested in supporting and ensuring that measures are supporting evidence-based care. So we have been in conversations looking for alignment there, but it hasn't happened. It hasn't happened yet, but we're continuing to work for it. And another question came in: can medication review be done annually for older adults? And Ariel, if you don't mind just going back to the other slide. And yeah, thank you. So the review, yes, each of these we have a picture just like this for hospitals, and with it's very, very similar. But on the ambulatory side, the expectation is that all of these things happen at least once per year. So yes, medication can be done review annually for older adults. And yeah, I love your reference to Louise Aronson, Dr. Aronson, in her wonderful book, Elderhood, that I highly recommend to everybody. She talks about older people having different reactions to meds than people in middle age. And indeed, without this medication review, harm can be done. So yes, thank you very much for that comment. We are very much on board with that. And you know, we recognize that this is hard work, and we also recognize that if we tie everything back to what matters, that really enables that to happen. You know, if somebody, this is a real story, an older adult says that, you know, I really want to work in my garden in the afternoon. That's really what matters to me. That's where I get to find my happiness. But the sun is in my garden in the morning, so I like to go in the afternoon when there's shade, but I'm feeling pretty tired in the afternoon. This is a conversation that took place with one of the physicians on one of our teams, and they were able to together, knowing what mattered to her and knowing that she wanted to get outside in the afternoon when her garden was shaded, they were able to identify what the medication was that was making her sleepy in the afternoon and adjust her medication so that she could get out in the garden in the afternoon. It's just a great example of how knowing what matters can really shift how we think about medications and can support older adults in taking good care of themselves. Thanks, Ariel. If you want to go on to the next, so you can skip right over. As I said, we want everybody to be able to be a part of this movement. We have 625 teams who are working on adoption of the 4Ms. We are thrilled that 314 teams have gone on to be recognized as age-friendly health system participants. That's a very first level of recognition in the movement. That level of recognition is achieved when you share with IHI through a survey link that you can find on ihi.org/age-friendly. When you share with us your plan for how you're going to be reliably practicing the 4Ms, when you let us know that that you have figured out how to practice the 4Ms in a way that's consistent with those 11 items that I shared. And the second level of recognition that 149 of those 314 have gone on to achieve is once you are spreading the 4Ms. So this is very consistent with remember I talked about the science of improvement as one of the underpinnings and the values of IHI. This is really reflected in the recognition here. You start by being clear on what the improvement is, and then you spread it. And so that's what you see in these two recognition levels. And thank you so much to Alice, just chatted in a website that's specific to care of older adults during COVID-19 that might be very helpful. And perhaps one of our colleagues might be able to chat in the link to our website and to the survey, so you can take a look at that as well. And if you go on to the next slide. I want to acknowledge HRSA as an amazing partner in this work. I am guessing that some of you might be GWEP participating practices. Actually, it'd be great if you would just chat in a yes if you happen to be, just be curious. And we're really pleased that the GWEP this year integrated the 4 M's. I know that kind of change doesn't happen with ease, and it was a relatively significant shift, and we're grateful that HRSA took the leadership to do that, and also grateful that AGS, the American Geriatric Society, is working with the GWEPs and with our partner practices to figure out how to put this into practice, and we're working closely with the AGS to support them, and it's great to see some GWEP practices chatting in. Thank you. And on the next slide, I really wanted to get back to you asked the question about whether PCMH whether we may ever have an age-friendly status be, similar to something like PCMH. And yes, for sure, that is something that we're working towards. And I also want to acknowledge that you are not just patient-centered medical homes, you're patient-centered medical homes for people of all ages. And this movement and engaging with IHI, as Laura is going to talk to you about, is really about closing the gap between what you're already doing and making sure that that 4 M's care happens every day with every older adult. So it's really building on your strengths. It's not a new program. It's not a new model. It's a framework to reorganize the care for all older adults. And on the next slide. One of the ways to engage with us is through an action community. And Laura, do you want to pick it up here and talk about the action community?
I would love to. Thanks, Alice. So an action community is a model that we use as one of our predominant mechanisms for engagement in the age-friendly health systems movement. There's no fee to join an action community, thanks to the support of the John A. Hartford Foundation. And this diagram that you can see on here on this slide outlines the action community approach that starts at the bottom arrow, working its way to the top. And during an action community, teams learn together what it looks like to locally adopt the 4 M's framework in their setting. The meat of the action community is taking the framework, learning how to adapt the 4 M's locally, and applying small tests of change during the learning and action periods that you can see working your way up the diagram. There are also in between the learning and action periods, there are webinars that bring the teams together so that they can learn from one another, as well as from faculty that take place and help lead the action communities. And by the end of an action community, the goal is for each team within their hospital, practice, or a post-acute or long-term community to have a system in place to count how many older adults are receiving 4 M's care every time. And earlier in the chat, my colleague Kellyanne chatted in a link to join an action community that IHI has launched in March and is still accepting enrollment through April. So if anyone is interested in this mechanism to engage in the movement, we'd be more than happy to speak to any questions about it. Next slide, please. This slide highlights some of the key components that takes place over the 7 months of an action community. The structure in the action community is a mix of participating in interactive webinars as well as in-person meeting, although in-person may be virtual given the state of all that's happening in our country at this time. as well as testing the forums interventions in between the webinars, as we previously mentioned, as well as working on a plan for practicing and adopting the forums as a set and working towards reliably delivering the care based on that plan that teams create along the way to support the ability to count the number of adults reached with the care that they're receiving. And the last element is a newly added one that's called the Scaling Up Age-Friendly Care series. That's a series of webinars intended for leaders, although anyone within an action community or across the movement can join. That's hosted by IHI to bring leaders together, leaders loosely, any leader within a health system or practice, to share around specific content like building the business case or creating a set of measures to be able to understand how to spread and scale up the 4Ms across the system, for example. Next slide, please. And then, so how can an action community support you and your practices at this time? We really adopt the mantra that all teach, all learn, and value the experience that teams bring to the table, and that expertise happens everywhere. So it's really a supportive community of learners and improvers that are brought together to improve the care for older adults in their settings. Teams are invited in an action community to participate in ways that make sense, especially in the context of COVID-19 and all that's happening at this time. And there's really the ability to have it be flexible enough to participate and stay engaged in the action community, but doing what's best for you and your practice. There's minimal data required to participate and engage in an action community, and topics are tailored around the needs and interests of the teams participating, as well as having it all be delivered through rapid learning for the participating teams led by IHI and faculty to support the learning and adoption of the 4Ms framework. Next slide. And so we know we've been referencing ihi.org/age-friendly, but that's really the hub of where you can find all of the resources we've been mentioning, as well as the guide to using the 4Ms, the cornerstone document, where you can really apply the 4Ms framework to your setting and to the care for older adults in your practices and in your community. And with that, I'll turn it back to Leslie.
Thank you, Laura. I am looking through the chat for questions or comments that we may not have yet responded to. It's great to see so many GWEPs participating. Thank you, Laura, for chatting in where people can get more information. A couple of links here for you. And I do want to reiterate that all of this webinar, this material, will be available to you, and everything that we've referenced is also available on our website. Again, as Laura said, with the support of the John A. Hartford Foundation, we're able to make this available to everybody so that we can reach older adults all across the country. I'm just trying to give people a chance to chat in. Any other questions? Alice, Bonner, Kellyanne, Pepin, anything that you would add that we maybe haven't mentioned yet? Feel free to chat or speak up.
Thanks, Leslie. It's Alice. I would just say, again, you may have additional questions that you think of even after we've hung up from this call. And in particular, if you are in one of these settings that is a nursing home, an assisted living, a skilled nursing and rehab, an LTAC, I would just reference back to the CDC and CMS are updating their guidance almost daily. And whenever new information is available to be shared. As well, I would just direct people back to your state departments of public health, because state by state there are different decisions that are being made by governors and health commissioners, and so it's always important to go back to your state. But we're happy to hear any of those questions as you go forward and be supportive for those of you who are working in particular in those settings. Thanks, Leslie.
Thank you, Alice. Okay. We have a question. Interested in annual wellness visits via telehealth? Yes, we just had a wonderful resource shared on our website of a script for an annual wellness visit via telehealth. I know that the VA is conducting those, so that is absolutely that's absolutely happening. In fact, we are working to integrate how to provide telehealth visits and annual wellness visits, providing some of those examples as we work together with our teams in this next action community. Very, very yeah, I mean, we have to figure out how to do this, and there is a lot of expertise that we're going to be sharing through the action community.
Right. And Leslie, it's Alice again. And I would just say that we do have, because of feedback from people like all of you on this call, we did add a telehealth section to that COVID-19 resources webpage for older adults. So there's 3 or 4 references there. And again, if you check back with CMS, they do put out resources on telehealth, and some of them are specifically about payment. So some of those are very helpful.
Thank you, Alice. There was another question about mentation and the health of the mind, and I think it was about could we focus on the positive health of the mind rather than the afflictions, if you will, of depression, dementia, and delirium. That's a wonderful comment. Thank you so much. I honestly will have to think about that, and I would be very open to your thoughts of what that might be, what that might look like. I will say that makes another important point about one of our other M's, which is mobility. I do want to be clear and explicit that we, with our expert faculty, made a very conscious decision to focus on mobility rather than falls, because we knew that one of the risks of falls was actually not being mobile, and so that's been a very intentional move to make sure that we're focused on the healthy movement of older adults rather than falls. And it's not that falls are still important to attend to, incredibly important for us to help older adults to avoid those. It's just that the way we wanted to help older adults move them was for them to help older adults safely move. So this is great encouragement for us to do the same around the health of the mind. So thank you for that. Ariel, thank you so much for the opportunity to be with you and with your colleagues and here. So I'm going to turn it back over to you.
Sure. Thank you so much, Leslie and Laura and all of your other colleagues at IHI who've been so helpful in the comments and over the phone in sharing your framework and all of the great resources that you have to offer this group. You've been very clear about where to go get that info, so I hope that answers a lot of folks' questions around what to do next. We will have the recording of this session available very shortly. And certainly encourage you to check out all of the resources at IHI, and certainly encourage you to check out any resources that you might be interested on our website as well. We'll link that in the email we send everyone shortly. You might have seen in the chat box that one of my colleagues put a link to the quick evaluation that we'd love for you to fill out. We'll send that in an email as well, but we'd love to hear your feedback, including any topics you'd like more support with through training and technical assistance activities over the coming weeks and months. So we have just a few moments left. If there are additional questions that haven't gotten answered or any other comments that you'd like to make, you can certainly do that now in the chat box before we wrap up. We'd like to thank you again for your time, your attention, all of your good comments and questions. I will say some of the questions that were around telehealth visits. The Center to Advance Palliative Care, CAPC, has put out some great telehealth guides as well, particularly when talking to seriously ill patients. They typically have a membership paywall, but they have all of their COVID-19 resources publicly available. We have that linked on our website as well. So I just wanted to put in a plug for additional resources. I'm so encouraged that there are so many helpful guides and resources during this tricky time. So again, lovely to see all of the chats in the chat box. If you don't have any other questions and you're still on with us, thank you again for attending. We will be back in touch very soon. And we'll leave it open for just a moment in case there's any other questions. Thank you so much.